Good evening, everyone. You're welcome to our today's edition of Instagram Live. We'll be discussing a very interesting topic. But before then, let's introduce ourselves. I'm Gbemisola. I'm a physiotherapist in Limi Hospital. Here with me is the clinical
Uh,
manager.
yeah, my name is Dr. Idoko, clinical manager of Limi Hospital. Welcome to our Instagram live.
Yes. So, as I said earlier on, that we'll be discussing a very interesting topic: evaluation and management of low back pain. So, doctor, how I feel we should. What is low back pain?
Well, low back pain in the layman's terms is every pain that happens around the waist area region. Okay, and it affects a lot of people. We see them in the hospital coming in with the same complaint.
Okay, so low back pain affect the waist region and affect a lot of people. Can you give us like, okay, are there particular persons that are prone to having low back pain?
Oh
Or
yes, the people that come in with low back pain are usually people who work in offices. They sit for long periods of time. People who do a lot of exercise, probably overdoing the exercise. So people who carry heavy weights, okay, and people who, you know, such people. And sometimes also you have people who come in with injuries from maybe accidents, falling on their backs, okay, affecting their,
mm,
injuring their backs as the case may be.
yes, yes. Okay. I think there are some people too that there are some people like the pregnant women,
Correct.
like
That is true.
let's say people with underlying conditions,
Yes,
yes,
that's true.
maybe cancer or whatever underlying conditions that they might have to might might present with low back pain.
Yes.
Yes. Sir, how about the presentation? Like when they come with low back, is it just low back pain? Are there no other symptoms that they can present with?
Well, the main symptom they come down with is pain on the back. Okay,
Okay.
this pain makes it difficult for them sometimes to change position,
Mm,
sometimes to stand straight,
okay.
sometimes also to even bend.
Yes.
Changing position from one position to the other,
Position.
it's very very painful.
Okay.
Okay, even walking is a problem sometimes. Okay,
Okay.
depending on the severity of the pain.
Okay.
Yeah.
Yeah, I realized that there are some people that will tell us that, I have back pain, but I still have pain around my thigh, my groin area. Is there any explanation to that?
Yeah, this explanation requires you to know a little bit of biology.
Ah,
Okay, the back
mm,
is what we call the backbone.
yes.
Okay, it's like you arrange a stack of coins on top of each other. Okay, that's how the bones of the back are arranged, with some things in between to make it easy for you to bend forward, bend backward,
Mm,
and so on. And in between these bones are where the nerves
nerves,
come
yes.
through.
Mm,
Okay, so for back pain that is caused by nerve entrapment, that means the nerve that is coming out is being trapped by these bones. You might have back pain that is also associated with pain that is shooting down your legs, okay, or even affecting
okay.
your ability to pass urine or stool.
Okay. Yeah.
So once the nerves are trapped like that, those are the symptoms we come. Apart from the back pain, you also have other associated symptoms like pain that is shooting down your leg and then find it difficult to pass urine sometimes or even going to toilet to use yourself.
Okay, sir. I think we should talk about the causes. The causes, like what are the things that we do? Like, does it involve our day-to-day activity? Because I know that okay, as I know that with the stress, does stress affect it? Like, okay, is there like a position? Is it like a postural kind of thing? Or I just want to know the causes, like,
Well, like we said earlier on, okay, people who do a lot of exercise, who carry
okay,
weights are
okay,
there.
yes, you mentioned that.
Then for people who work in offices, especially people who deal in IT areas, You find them sitting
When they
down
sit down for
in a
long,
particular position for
for
a
a long
very long
time.
time. Okay. When they do that, the muscles of the back tend to just maintain that posture. So each
Yes,
time they try to change position, there's this shooting pain that comes up.
pain.
So and then they
Okay,
come complain of low back pain.
okay.
In the same vein, sometimes you have some growths, especially for older people.
Yes, sir.
Okay, you have
Yes, sir.
some things growing in their back. Instead of the bones compressing the nerves, this time these are the growths are the ones that are actually compressing the nerves and
Yes.
causing the pain.
Okay.
Okay, and so we
Yes.
also mentioned that sometimes you have injury to the back. Some surgeries can also result in low back pain. And then for people who sit in the office, if the chair is not the ideal type of chair for them to sit in, it can result in low back pain. For those at home, if the foam on your bed is too soft,
Yes.
okay, you can't lie straight. When you lie down, the center goes down. By the time you're sleeping in the night, your position is wrong. By the time you wake up in the morning, you come down with low back pain. Okay, so those are some of the causes, among other things, that could result in that.
Okay, doctor, you mentioned pain, sleeping on mattress, a firm mattress now. Okay, for us that might not have that kind of mattress, can we just sleep on the floor? Is it fine sleeping on bare floor?
Well, though we're going to talk about the treatment modalities
Mm,
later on,
later on.
but if that is all you can afford, sometimes we advise people to get foams that are a bit harder, a bit
If
more firmer,
yes.
okay, because that too is one way of treating low back pain. But in case you don't have that means at the time, lying on the floor, either on a mattress or on a mat, for example,
Mm.
or even on a duvet or a carpet, might be able to solve the problem
I
a
just
bit
want
more.
us to know if lying on the floor is not going to cause more harm than good.
Well, like I said, the reason for the low back pain for such people is because of the mattress, the consistency of the mattress.
Yes.
Okay,
So
if the better alternative to that is lying on the floor.
lying on the floor.
Yeah, because the floor is firmer, is straight, and then when you lie on it, it relaxes the muscles of your back, so the pain is supposed to go.
Okay. So when a patient or a guest or a client comes to the hospital telling us about how they've been experiencing this pain for a long time, are there like a classification to this pain? Like, because I know that there are pains, there are acute pains. Sure, there will definitely be acute low back pain. There are subacute low back pain. Then there's chronic low back pain. Am I right, sir?
You're right. The reason for the classification actually is to help us know what kind of treatment to give such people. Okay, we classify it as acute low back pain is pain that has occurred within 6 weeks,
6 weeks.
okay, of presentation of coming to the hospital.
Yes.
And then subacute low back pain is for those that has been there for more than 6 weeks
Mm.
or less than 12 weeks
So,
or 3 months.
okay.
Okay. And then finally, the chronic low back pain are those who have been there for 12 weeks or 3 months and above. That
Okay.
is how we classify. This helps us to know what type of treatment to give each person as a present.
So now, are there any are there any investigation? How do we examine a low back pain? Because I know as a physiotherapist, as I've said, as a physiotherapist, there are some when a client comes to the clinic complaining of low back pain, what we hammer on is aside from our physical assessment where we carry out our physical test, what we hammer on is the history. How did this pain start? And why we do that is to know if it was caused by trauma or maybe it has been for a while, or it could even be that the person was down with malaria and presented with the pain.
Yeah.
So I want to know, are there any other things that will put in place for us to be sure to confirm that okay, this person is actually experiencing low back pain?
Well, like you rightly mentioned, For us to know exactly what kind of pain the person is suffering from,
Mm.
we need the history. The history tells us possibly what is the cause of the low back pain, one. Number two, how long the low back pain has
Has
been
been
there. We also want to find out anything that the person may have taken before coming to the hospital to
true
ameliorate the pain that the
pain.
person is experiencing. Apart from that, also on the clinical side, we do a physical examination to see if there's any deformity of the area the person is
Because
complaining
for somebody that has been experiencing low back pain for a while, there might be sort of
Yes,
deformity. It could be spinal, it could be with the spine,
um,
maybe probably with the way the person
the
is
person is
walking
walking
and
or
all.
the
Okay,
posture of the
the
person.
posture
Yes,
of the person.
very,
True,
very important. How the
true.
person stands, how they sit, how they lie, and how they walk as well. These
Yes.
are questions we want to ask to find out so that it can help us arrive at a definite way of understanding the pain, the cause, and how to go forward in managing such
Okay, sir. So for I think I would add that yes, aside, yeah, we are going to do our physiotherapy. That's for clinicals, because when you come, we'll get the history as you rightly said and all of that.
But
And
also, sorry for cutting in.
all
Of
right,
course,
sir.
apart from the history, there are some other things we do to help us understand the pain more, or the sickness or illness
Mm,
more. One of them is X-rays. We do X-rays to check if the thing is actually affecting the bone or the
yes,
bones are intact.
that.
Okay, you see, like I explained before, the bones of the back are arranged on top of each other like a stack of coins. Okay, and sometimes the thing that separates the bones because of either position or trying to lift something heavy from the ground. There's what we call a slip disc.
Yes, sir.
That is what separates the bones. Sometimes because of lifting a heavy object from the floor of the ground
Improper
an improper way,
way.
okay, it might lead to that disc slipping out. And when it slips out, it can press on nerves, resulting in severe back pain. Okay? And of course, because there is bone involved, there sometimes some people can have fractures, okay, that can result in that as well.
Yes. I don't want us, even though I don't want us to bore our viewers at home, our listeners at home about the clinical aspects. I just want to chip it in that low back pain is like a word for like pain at the back, just like that. But with the assessment, the what's it called, the radiological investigation, the physical assessment, even with the history, we can now categorize the low back pain, and we will know because there are some low back pain, there are some like lumbar spondylosis, lumbar radiculopathy, and all of that. Yes, everybody know them as low back pain, but it's until you come to the clinic and get a proper assessment that will be able to distinguish and will be able to tell you what what exactly is wrong with you. Then, because if we did not get that right, we might not be able to address the root.
Problem.
Yes, we might not be able to address the problem. So by the time we do all of that, because I can have low back pain now and it's just at the back, and somebody else can have the back pain and it will be radiating towards the thigh, as doctor has rightly said. So now there is a difference. So we need to know what exactly happened. We need to know what exactly happened, and then how are we going to know? By the radiological investigation. There are some people that would even send them to do MRI, because when you check the X-ray, sir. Am I
Yeah,
right? Yes.
yeah. There are some tests, some kinds of low back pain, the causes of which even the X-ray itself might not be able to show us. So we
Yes.
need a more detailed test, which we call an MRI,
MRI.
that look at it much more closely than an X-ray. And whatever the X-ray may have missed, the MRI might be able to show us.
Show us,
All
yes,
this is in a view to getting the right cause of the
of
pain
the
so that we can address it properly.
properly, because we can't. We need to know the right cause. We need to know it's not about just using paracetamol for headache. You need to know what exactly is the cause of this, so that we'll be able to address it well. We'll be able to address it well. And I believe that, and I think that it's best to when you have back pain, when you experience back pain, sir, yes, let me ask, sir, when one experiences back pain, like, do we need to wait for a certain period before coming to the hospital, or as you've just experienced, you just come straight? Or do you think that there are some back pain that, okay, when you ignore, it will just go?
But this brings me to say that, of course, there is a different classification of back pain as well. There are back pains that have causes that we can detect. And there are also back pains that we cannot find a cause for. So generally, for back pains that don't have a cause, for example, as soon as you don't have to come to the hospital immediately, you begin to experience it. Sometimes
Okay.
you might wait for 1 or 2 days and the pain might disappear on its own. Or you might just use mild pain
Pain
relievers like
reliever, and you will
paracetamol,
not
and
experience
before
it
you know
again.
it, as you're preparing to come to the hospital, even when you come sometimes, you start looking for where the pain is and you can't find
True,
it.
true.
So you don't have to come immediately. You may have
Okay.
to, though there are some things that will make you want to come, that will advise you to come immediately. For example, you have a low back pain that is shooting down your leg, you have a low back pain that is affecting your ability to urinate,
Yes, sir.
you have a low back pain that makes it difficult for you to even turn on the bed in the night. Probably want to come down, go and ease yourself, and you can't because the pain is so excruciating. For such pains, we don't want you to waste time, we want you to come. And low back pains caused by an accident, maybe something hits you on the back, for example, you need to come to the hospital so that we can check you out and know what the cause is. Because sometimes if a delay for such might result in complications that make things a bit more difficult to manage.
Okay, so I want to know, and I'm sure my viewers will want to know, are there a particular, like, okay, is there any drug that one can take that could predispose someone to low back pain or to pain generally? I don't know. Maybe their side effect or something, so
Well,
that in case they are on such drugs, they would know, so that they will not panic. In case, I'm just asking, I don't know
well,
if we have
I don't think of, I can't think of any
any
drug
drug.
that will come to mind now to say, okay,
Yes.
we are taking this, it can result in low back pain.
Mm-hmm. Okay. Okay, sir. So let's move straight to treatment, sir.
Okay.
Let's move straight to treatment. Yes. We've said that treatment comes from start with no not comes from start with assessment, the history, because it's when you get the history right, it's when you get your assessment right, that is when you get your diagnosis right, and when you get your diagnosis right, that is when you definitely get your great treatment. Yes,
Whatever you need to do.
whatever you need to do. So now, treatments, are there drugs, injection, or what have you? What can we do for low back pain?
Well, like we said, low back pain, we've classified it before acute, subacute, and
Subacute,
chronic.
yes,
Okay.
okay, sure.
So depending on which class the pain belongs to, it also helps us to determine what, if at all, the person needs drugs, or maybe they
Maybe
may not.
lifestyle modification.
Yeah, because treatment of low back pain is not just drugs. Okay, for some people with low back pain, we might find that they may just be overweight. Okay,
Yeah,
because
true.
all the weight we have up in the upper part of our body is carried by that waist region.
Yes.
So if we're too heavy up there, the pain will come.
Mm.
So sometimes you might just tell them, instead of taking drugs, just try and work on your
Oh,
weight.
wait.
That's lifestyle
Oh,
changes.
yes.
Okay, you try to watch your diet, and then you try to join an exercise. Okay, so that you can um, bring down your weight and thereby reduce the stress you're putting on your lower back. Okay, apart from that, of course, then for people who are maybe who are diabetic, who have sugar issues or something, or who have cholesterol issues, it's really very important to watch their weight and work on it and their diet. Then, apart from that, of course, for those who have been in pain for maybe that all they who have done all this we've said, and the pain is still not going away, we may have to introduce them to medications that will help with the pain and also help with relaxing the muscles of their back. Okay, before the medications, We can also use hot packs, okay, on the back. We can also teach them how to sit properly in the office, okay, and then how to do
Because I think improper posture is like the major
is a
factor.
major factor. Okay,
Yes,
so
especially for somebody that's been active, that is active, and all of that. Improper posture, the way they sleep, the way they walk, self, the way they sit, and all.
yeah, it's really very important the posture matter because
Mm.
I know a lot of offices don't have the right set of chairs,
Cheers.
okay, and your work is so important. Sometimes you sit in a wrong position, in a wrong chair,
For a
because you
long
are
time too.
only working against time. You want to submit this report, you
Mm.
want to do this, you forget about your sitting position. By the time you finish and you get up, it just hits you, okay, and then you come down with no back pain. Sometimes for such people, you can walk for 2 hours, get up, walk around for
Walk
15
around,
minutes.
yes.
Okay, you stretch yourself, because the muscles they tend to sleep when you sit down in one position
For
for
a,
too long.
yes.
So for 2 hours, you can get up, walk around for 15 minutes, chat with your friend, just stroll around, stretch yourself, and it will just solve the problem. Then, of course, like I said, those that are very severe or who are the pains that are difficult to manage with such this thing, you may have to introduce drugs.
Mm.
Simple drugs like paracetamol might help. Then you might go as high as either diclofenac. I'm just mentioning them now, but
Yes.
usually I don't want to mention classes.
Yes.
Okay, and then for very severe pains that have been lingering for a long time, you can use things like tramadol and so on. Okay, or you want to do cocodamol, and sometimes you can also use panadol extra, like they said, which works longer than the normal panadol.
Okay.
Yeah,
Yes. So I'm going to.
and finally,
Alright, sir.
for some,
Mm.
very few, okay, not so many, very, very few of them
Surgery.
might end up in surgery.
Surgery.
Yeah,
Yes.
they
Yes.
might end up in surgery,
Yes.
and that's a specialized area entirely. But just few of them get to that point. Okay, most of them would have been solved by the two.
Especially when they present early to the
Yeah,
hospital.
and
Yes.
for those who end up in surgery, there are those that pain is there, is affecting their ability to move their legs. Okay, that one is actually
It's already
something.
causing the
Yeah, is
imbalance and all.
compressing something at the back, is pressing on something at the back, something major at the back, making it difficult, weakening the legs, and of course using themselves also may come into play.
Yes. From the physiotherapist view, when a patient comes to the
So
clinic.
I forgot to mention
All
that
right,
that's
sir.
also one type of treatment. Okay, outside the drugs, you can also refer to the physiotherapist. We have a wonderful one in Limi Hospital. Okay, and you just come, very easy to enter in, and then from reports so far, the ones that they have handled, gotten good reports, people come back praising us. So we have that available and you can access it anytime.
Anytime, anytime. So what we do in the department is what we do in the department is okay to manage it, to relieve the pain. We'll use our hot pack depending on the duration of the pain. For a chronic pain, we use the hot pack. For the acute one, we can do the cold pack. Then we'll stimulate the muscles and the nerves because at over time the muscles gets weakened, so we'll need to stimulate the muscles and the nerves. Then we'll prescribe exercise. That is just it. Exercise will give you, we instruct you just like you get your panadol, you get your paracetamol. We'll tell you this is the exercise you'll be doing. Do it at so repetition, twice daily, 3 times daily, and all of that. Then too, we have some manipulations and some mobilization that we do to correct such things, especially for people that comes down with radiculopathy, pains down the thigh and all. So that is what we do in the physiotherapy
I think
unit.
you also involve UV lights. I don't know if you still use that.
The light.
UV lights.
Yes, yes, yes. We use that. We use infrared lamp. That is
Yeah.
as as a means of our hot pack, we use the infrared lamp, and it's
Okay.
very soothing. People sleep under it. This our treatment is not invasive at all. It
Okay.
is not. It's very
Simple.
very simple. You will enjoy it, and the atmosphere is so nice. So when you come to Limi, just expect to get your first class treatment, and that is it so far.
Yeah.
Yes. So then
And
the treatment can go, the treatment here, we need to mention this, that the treatment, low back pain treatment is not a treatment that you just come and say, okay, tomorrow you are not coming again, it will go. Definitely, especially when you visit a physiotherapist, you would get a relief, you will get a relief. But the you will get the relief, but we need to let you know that after that relief you need to complete your session, because if you did not complete the treatment session, this pain will come back. Why? Is because we have not addressed the root cause. So depending on the presentation, depending on our diagnosis and all, we have our session, we have our treatment session that we draw for them, and we'll beg them to please oblige, because if you do not, it's not going to, we are not even going to achieve anything. So treatment session varies from 6 sessions, from 6 sessions to like, it depends, it
so,
depends,
so
but would
let me just chip in here. For physiotherapy, for example,
mm,
I think it depends on how long the pain has been there,
yes sir,
the cause of the
very true
pain.
sir.
Okay, and then so for that, they prescribe, like we prescribe paracetamol for 3 days.
Mm,
They prescribe sessions.
yes,
In a short,
sessions,
they can give you maybe 6 sessions for a short, for okay, 6 sessions for a particular kind of low back pain,
mm,
and then or for some people it might be longer depending on how long they've been experiencing the low back pain.
okay,
If viewers, if you're just joining
okay.
us, you're welcome. This is Instagram Live, courtesy of Limi Hospital, and welcome to the session. So,
We've been discussing a very interesting topic, low back pain,
yes,
the assessment, the how we do our diagnosis, then we are on the
the
treatment now.
treatment
Yes,
methods. Okay, so like I said, it depends on how bad it is. The sessions can be 5, it can be 7, it can be 10. And these sessions are not just plucked from from the blues.
sure.
They are, categorically set for each type of pain. And you must complete the session for you to have a full
Full
treatment.
treatment and full
For
recovery.
example, you are treating malaria, you say you take this drug twice a day for 3 days, and you take it for one day, and you expect the malaria to go, it won't go.
Thank you very
In
much
the
for that
same
illustration.
vein, if you are coming for a physiotherapy treatment for low back pain, we tell you come for 5 sessions, please do it. Okay. And as well, apart from the treatment, they are going to show you how to be sitting in the office. We also can give you a letter to your organization that the chair this person is sitting on is a cause of his or her pain.
Yes.
This chair needs to be changed. By the time we communicate with the organization like that, they know this is coming from professionals and they will oblige you. Okay. So apart from that, okay, the exercise I should mention is also very
Very,
important.
very
And
important.
once you start the exercise, it's not something you start and stop. You make it part of your
Part of,
lifestyle.
yes.
Okay, the food, you make it part of your lifestyle. You want to lose weight, you don't lose weight and then go back to the way you were eating. You
Sure.
have to continue it as part of your life, so it becomes part of you, and before you know it, that is how you do your thing, and low back pain will be a thing of the past.
Yes. So we have a lot of testimonies of how the low back pain had already got like 100% recovery, 100% recovery, and this is because they followed every instructions. Yes, they follow every instruction, and we have some people too that they are still struggling. There are a lot of, you need a lot of counseling, you need to encourage them, because I mean, stress from work and all of that, you need to let them know. Yes, very important, let them know why they are doing this exercise. We tell them why they are doing this exercise, how this exercise will help them, because I mean, everybody wants to do what will help.
Yeah,
So
the In the office, for example, we cannot tell you to leave your job. Your job is very important to you.
Sure.
So part of the physiotherapy treatment is teaching you how to cope with your job. Okay. By the time they do this, you're able to do your job and then be free of low back pain.
Yes.
It teaches you how to cope with your job. Though in some extreme cases, we've actually written to some organizations that the type of job this person is doing is the main cause of low back pain. Is it possible? Is it possible to adjust this? And some organizations have come forward to oblige our suggestions, and their staff have been better for it.
Okay. So viewers at home, if you have any question, you can please send your question in. Let's give you the professional advice and all. So we have a question here. What causes back pain?
Well, like we said, we illustrated or at least spoke about at the beginning of the session. We said low back pain can be caused by one, poor sitting position. Number
Very,
two,
very important.
yeah. Number two, overindulgence in exercise. Okay,
True.
exercise is good, but like they said in the layman's language, too much of anything.
Sir, sorry to cut you short. Sorry to cut you short. But I think they need to know. We need to educate because there are some people that believe that going through stress, going, walking, doing house chores, and all of that, they're already exercising.
Well, I usually tell my patients that for those who say, okay, they climb six stairs every
Mm.
day to go to the office and come back, they sweep the whole house, mop the whole house, work in the kitchen. I tell them that, look, this is what you have been doing all the time. That is why you are the way you are. For you to come down from where you are to where you ought to
You
be,
need to do
you need to
something
do an
different.
additional thing. Okay, either you need to watch your diet or you need to do an extra exercise. We're talking about is not something you don't have to go to the gym and lift weights like
Sure,
you're supposed to do. Okay,
sure.
all we need you to do is 30 minutes of exercise, something that will make you sweat, make your heart race. Maybe 30 minutes 3 times a week. Be consistent with it and you can see a change in life. That's exercise. Then of course, sitting down, like we said, lifting very heavy weights in the wrong way.
We.
There is a particular way that you lift weights that does not put too much strain on your back. Remember, we're talking of low back pain. So all the pain we're talking about is at the back. Okay. And of course, in talking about exercise, we have our health walk
Yeah,
tomorrow in
tomorrow.
Limi Hospital.
Yes.
You are all invited.
Invited.
The good thing about this health walk is that there are frisbees. You can come, you check your blood pressure for free. You can do your sugar for free as well. And then, of course, we can refer you to a physician that will take care of any ailment that we find. But very importantly, the health walk is held at the last Saturday of every month, and the first edition for this
For
year
this year.
is tomorrow.
Tomorrow.
So you are all invited. I hope I'll see you and you will see me.
Yes, because we'll be there
We'll be there live.
live. So, okay. We have another question here. What is the role of exercise and activity modification in patients with back pain? So I think I should the role of exercise and activity modification. Okay, yes. Exercise and activity modification, that's lifestyle modification. Yes. They have like important role. And I mean you cannot just leave one and do the other. You need the two together. Everyone needs a lifestyle modification because at the end of the day, even if you think, oh, you're sleeping right, you're sleeping on an orthopedic mattress, you're sitting well, by the time we engage you professionally, you will realize that there is a particular thing that you are not doing right.
Yeah, well,
So
like she was saying, Exercise is very, very crucial in
Very,
your
very, sir.
everyday life. Remember, they said that all work and no play makes Ogochukwu a very dull girl. So, exercise is very important. Remember, you work from Monday to Friday, you're sitting there in the office, you don't do anything, your muscles are just there sleeping. By the time you exercise on Saturday and Sunday, or even in between those days, you stretch your muscle that has been in one position for long. It makes them supple, makes them able to withstand the stress of your everyday. Okay, and then for those who have become stiff, you can relax the muscles through exercise.
And I think we should
And
mention that.
also, sorry,
Sorry,
of
okay,
course,
sir.
it reduces cardiovascular risk. It
Mm-hmm.
reduces all those risks that we are afraid of. People with hypertension, diabetes, and co, high cholesterol. The exercise increases your body weight so that those things you're afraid of can be reduced to a minimum.
And also, we have some physiotherapeutic exercises that are particular for like for different kind of low back pain. Remember, we said it that we have like yes low back pain, but we have other pains that we have other things that can
Result from
result here from it. So we have some specific exercise drawn. It's not about you doing your treadmill at home. I would just advise anybody that is experiencing a back pain, before you start any exercise at home, just come to Limi Hospital, get your professional advice, get your professional treatment. Then we will now know, okay, whatever exercise you are intending, will know if this exercise is good, because not everybody that has back pain would recommend treadmill for, and it's not every one of them too that will recommend bicycle for. So there are some exercises that are particular to a certain condition. So I feel that if you are watching us live now and you are experiencing back, even if it is a day old, it's best for you to just get a professional advice. Let us know, let us guide you in this exercise that we are talking about, because I know there are a lot of people, so there are a lot of people there that will be like, ah, exercise, okay, let me start carrying whatever,
but
what, and all of that.
what they say in the world is prevention is better than cure.
Yes,
Okay, so if you have to start exercise, if you have back pain, we are recommending exercise now, but of course, there are different exercises for different types of back pain.
yes,
The only people who can tell you which one fits your kind of back pain are the physiotherapists and the doctors. So if you have back pain, you see your doctor. I'm recommending Limi Hospital, for example, to come. We
first class
assess you
hospital.
properly and we then recommend the kind of exercise that will take care of the problem. You don't just jump into any exercise
You don't
because
just
your friend is doing
he's
it.
doing it.
Because you might do that, and instead of it solving your problem, it might
Get
aggravate
worse.
it.
Yes.
So you need to see your doctor, let them assess you properly, and then recommend the kind of exercise that will fit your kind of pain.
Yes. Thank you very much, doctor. Doctor. Okay, we have a question here. Does back pain runs in families?
Well, yes, of course, there are people who have some problem with the back. It's possible, though not always. We've seen people that maybe their grandmother had back pain, their father had back pain, and then they come down with it. Okay, so it's possible that you can have that.
Will bed rest, sir? Will bed rest make my low back pain better?
Like we said, there are different types of low back pain.
Sure.